Hello, my name is Helga Stopper and I'm a professor for toxicology at the Department of Pharmacology and Toxicology at Würzburg University in Germany. This lecture will introduce examples for emerging and priority pollutants and give a general introduction into this research area. We are facing increasing threats to health and well-being. Our health is interconnected with that of plants, animals, and ecosystems. This is recognized by the One Health approach, which identifies chemical pollution as one of the problems. Of course, chemical pollution covers many different substances. Here I would just like to give some examples which are also important to consider their burden on the environment. And these examples will be endocrine disruptors, which are substances that disrupt hormonal balance, and then small particles such as fine dust, nanomaterials, or microplastics. And then I will briefly introduce so-called e-waste, which is electrical and electronic waste. I will very briefly mention pharmaceutical residues in the environment as a new problem. And in the end, I will also briefly mention climate changes as a reason for some substances becoming more important. And for this lecture, I would like you to take a pause right here at the beginning and read about emerging pollutants before you listen to the rest of the presentation. Please plan about 30 to 60 minutes for that, and you can read, for example, the following publication which deals with the potential threat to the marine environment. The first example of so-called emerging pollutants are endocrine disruptors. Endocrine disruptors are chemicals that disrupt the functions of hormones, and they can be harmful to health by disturbing growth and development, influencing reproduction in a negative manner, increasing susceptibility to specific diseases, and by exerting carcinogenic effects, for example, as tumor promoters. In recent years, endocrine disruptors have been given increased attention, but they have been known for a while. So for how long have they been known? Well, since there has been a large amount of industrial waste in the environment, which is after the 1950s. First, they became known in cases of particular pollution, for example, after chemical accidents. And I would just like to give you 3 examples from wildlife where this activity of substances was first detected. The numbers of bald eagles around the Great Lakes in the USA were reduced in the 1960s because contamination of fish in the lakes with the pesticide DDT led to thin eggshells. The chemical blocks the signaling pathways that control calcium deposition in the eggshell. After DDT was banned in the 1970s, the bird population slowly recovered. The numbers of alligators in Lake Apopka, Florida, was reduced after a chemical accident which polluted the lake with DDT and its metabolites in 1980. The male alligators had smaller penises, more estrogen, and less testosterone in their blood. And as a third example, in the 1980s and 1990s, female sea snails in Europe, Asia, and the USA showed penile growth and were sterile. The tributyltin, as abbreviation TBT, contained in ship paints was identified as the responsible chemical, and its use was then severely restricted. As a first example for endocrine disruptors that have been discussed a lot recently and are definitely emerging pollutants, I would like to mention PFAS. PFAS is an abbreviation for per- and polyfluorinated chemicals. They are a group of chemicals which include about 10,000 substances. They do not occur naturally, and they have only been produced since the late 1940s. They are water, grease, and dirt repellent, as well as chemically and thermally stable. They are used in numerous consumer products, such as cosmetics, cookware, paper coatings, textiles. And they are also used for surface treatments of metals and plastics, in pesticides, and in fire extinguishing agent as a component. They can be absorbed by humans primarily through food, including drinking water. And they are introduced into food in different ways. since they can be detected in soil, in drinking water, in animal feed, and also in consumer goods, for example, in food packaging materials. The next example for emerging or priority pollutants are dioxins. Dioxins were never produced on a technical scale, so they were not produced intentionally. But they can occur during combustion processes in the presence of chlorine and organic carbon. Therefore, they are formed as a contaminant in products during chemical production processes in which chlorine is used. The most toxic dioxin is 2,3,7,8-tetrachlorodibenzoyl-dioxin, also called the Seveso poison, or TCDD. And Seveso poison, the name is according to an accident that happened in the city of Seveso in Italy in July 1976. It was a chemical accident in a chemical production plant. Thousands of dead animals in the environment of the production plant were the result. There were no human fatalities in a confirmed connection, luckily, but there were hundreds of people with severe chloracne, which is really very painful and very difficult to treat. Contrary to maybe expectations, the overall cancer incidence was not increased, but there was a shift in tumor types. And most strikingly, the sex ratio at birth shifted due to the hormonal effects of TCDD. There is this study, for example, where I show a little table here, and it shows the distribution of the sexes at birth between 1977 and 1984 among a number of families, and some of them, families 1 to 9, were heavily exposed to TCDD, while families 10 to 13 were much less exposed to TCDD. And you can see that in the heavily exposed families, there were no boys born in that time. Only girls were born to these families. I would just like to briefly mention a few more endocrine disruptors without going into detail about them. Some pesticides are endocrine disruptors. Organotin compounds such as tributyltin was briefly mentioned in the first slide about the endocrine disruptors in the cases in wildlife. Bisphenol A, which is a monomer of polycarbonate plastics. Phthalates are endocrine disruptors. They are plasticizers in plastics. And then there are surfactants such as nonylphenol, which are categorized as endocrine disruptors, and flame retardants such as polybrominated diphenyl ethers, PBDEs, and many more substances which have been identified as endocrine disruptors. Now I would like to move on to the next category of substances, to the small particles such as fine dust, nanomaterials, and microplastics. And as a first example, I would like to tell you something about open fires. There are wildfires to consider. With thousands of fires, 2023 was the worst wildfire season in Canada's history, for example. And the smoke reached, in a diluted fashion, all the way to Europe. And it led to particularly red sunsets here in Europe. And then there's another category, which is cooking on open fires. Many people in developing countries cook with open fires, often indoors. The WHO estimates that this results in around 4 million premature deaths every year. This particularly affects women and children in poor countries. So now, about open fires, what is their health threat regarding fine particles? The combustion process produces many pollutants such as soot, fine dust and gases, which enter the surrounding atmosphere and also enter into the human body through inhalation. Possible pollutants include, in addition to soot particles, fine dust and carbon monoxide, also organic compounds such as carcinogenic polycyclic aromatic hydrocarbons and others. And there's something specific about the particulate matter, the dust. When it's very small particles, they're called PM2.5, penetrate very deeply into the lungs. And the smallest particles can also enter the bloodstream and then reach all organs in the human body. Upon inhalation, local irritation of the respiratory tract can happen, but also diseases such as increased plaque formation in the blood vessels and even stroke or heart attack have been found to be possible consequences. In fact, particulate matter is now one of the top 10 risks for premature death. And as a next example for small particles, I would briefly like to talk about microplastic in the ocean. Every year, millions of tons of plastic end up in the oceans. The area of the Pacific Ocean garbage patch, for example, is 3 times the area of France by now. It takes hundreds to thousands of years for it to completely decompose. And it is estimated that each year 100,000 marine animals drown or suffocate due to plastic items. Currents and friction processes create even smaller particles. Below 5 millimeters in size, these are called microplastics. These small particles are a huge problem in the sea because marine animals mistake them for food such as plankton. But are these microplastic particles also dangerous for us humans? The German Federal Office for Risk Assessment, the BFR, assumes that microplastics do not endanger health. Apparently, the human body excretes the microplastic particles. For submicroplastics and nanoplastics, it is not yet known with certainty whether and in what quantities they can enter the human body. But also, plastic can contain plasticizers and other questionable components, which may leak out after we've ingested them. Many other organic substances accumulate on the surface of microplastics, including long-lasting, hardly degradable environmental toxins, for example hydrocarbons or the earlier already mentioned DDT. And when they have attached to the microplastic particles, they are eaten up by marine animals, and then in the food chain we are last. We may also take up these substances. The Hamburg University of Applied Sciences found in 2015-16 already that microplastics contain 3 to 4 times as many toxins as the seabed next to them. Now I would like to introduce another group of pollutants, the so-called e-waste. Hundreds of thousands of tons of used electrical or electronic devices are delivered from industrialized countries, for example, to African countries every year. Supposedly they are repaired and can be reused, but approximately 75% of these devices end up as electronic waste, so-called e-waste. The problem is then that workers, which are often children and young people, extract materials from these e-waste sites using very primitive methods. I would like you to take a pause here and read about the problem of e-waste before you listen to the rest of the presentation. I would estimate that this may take about 1 hour, and you can, for example, use the publication listed here. And maybe you want to try and answer the following questions. What are some of the major pollutants released by e-waste? And what could be measures to improve the situation? So here are some facts about e-waste. E-waste is damaging the health in the global south. A child who eats just 1 egg from a chicken from a particular landfill in Ghana, an e-waste site, will consume 220 times the EU daily limit for chlorinated dioxins. Only 17% of e-waste ends up in good standard recycling plants. The rest is disposed of illegally, mostly in poorer countries. More than 1,000 pollutants can be released, including lead, mercury, nickel, brominated flame retardants, and polycyclic aromatic hydrocarbons. Consequences include impaired lung and thyroid function and an increased risk of chronic diseases such as cancer and cardiovascular disease. Measures are really needed on a regional level, for example, by creating better controlled and safer work environments, and on an international level by improving and reinforcing legislation in this area better. Now let's move on and briefly touch another important area of environmental pollution, an emerging area. This is pharmaceutical residues, which may accumulate in the environment. One has to consider that drugs are optimized for stability during their development. About 4,000 active pharmaceutical ingredients are administered worldwide in prescription medicines, over-the-counter therapeutic drugs, and also in veterinary drugs. And an estimated 50% of them may be environmentally relevant. I just want to give the example of one particular pharmaceutical, which is diclofenac. Diclofenac demand on the world market is huge. For example, in 2018 it was more than 2,000 tons. It is especially used against pain in the musculoskeletal system, often applied as ointment or gel. But only a few percent of the active ingredient, which is applied topically, is taken up through the skin. Up to 95% remains unchanged on the skin and is later washed off, ending up in surface waters. And I would like to briefly point out another problem which arises from the use of pharmaceuticals, although this problem is not directly related to the contamination of the environment with pharmaceuticals. I want to talk about the global burden of antimicrobial resistance. There's a 2022 analysis in Lancet, and it was found that in 2019 there were 4.95 million deaths from diseases in which antimicrobial resistance plays a role. 1.72 million deaths were a direct result of resistance. So, drug-resistant infections killed more people than HIV or AIDS or malaria. In Europe alone, more than 30,000 people die every year as a result of antibiotic resistance. One has to consider that most antibiotics, more than 70% worldwide, are not used for sick people, but in animal husbandry. Resistant bacteria have meanwhile even been found on vegetables. And why is that? How can that be? Well, the idea is that it is caused by exhaust air from stables and by putting manure into the fields. Therefore, also the problem is not caused by pharmaceuticals in the environment directly, at least not to a large degree. The environment and our health are affected deeply by it. To just point out one thing where we can all contribute to an improvement of the situation is the following: disposal of medication. Old medications are often disposed of incorrectly by patients. For example, unused liquid medications are often disposed through the sink or toilet. But we are not aware that sewage plants are not equipped to eliminate them. There are recommendations for safe disposal, but they vary between countries. So I do not want to give general rules here, but to encourage you to check the recommendations in your country. There may be return options, or there are sometimes lists for specific procedures for some drugs. So please ask your pharmacist or research the internet regarding recommendations in your country. All heard what about climate change in recent years. You can see in the upper panel of this figure that global warming can be observed, and we have really reached an increase of more than 1 degree. In the lower panel, it is shown which forces affect the global temperature. You can see that due to volcanic, solar, and natural variability, there's always fluctuation. But the human-caused increase of temperature is clearly different from that. As a last point of this presentation, we will have a quick look at how the climate change may affect exposure to some pollutants, in some cases making them emerging or priority pollutants. But before we talk about this, I would like you to take a pause here again and do some reading about climate change and about options for a just and sustainable future. And you could use the literature that I've listed here, and please plan at least 1 hour for reading this publication. One example where the altered climate can lead to more toxicity is toxic bacteria in water. In warmer surface water, there's an increased growth of bacteria which may be toxin producing. They are, for example, the toxic blue-green algae. And what we refer to as toxic blue-green algae are really not algae, but they're cyanobacteria. Direct skin contact may cause irritation because the cyanobacteria produce toxins. If swallowed, they can cause nausea and vomiting. If ingested in large amounts, they can cause liver and neuronal damage. And the rising temperatures promote the algae growth in fresh and seawater. The second exam where the climate change changes something regarding toxicology is the example of poisonous jellyfish. For example, the Portuguese galley, which is normally found in the Pacific and Caribbean, is now also sometimes observed close to the Canary Islands in Portugal. And sometimes beaches in Europe have already had to be closed because of their appearance. The contact with them is very painful. It is not life-threatening in healthy adults, but could become dangerous for not so healthy adults or children. And this is because jellyfish like warm and nutrient-rich water, which the climate change brings along. And therefore, types of jellyfish come to Europe which originally were not located in Europe. And it may be interesting that jellyfish kill around 100 people every year worldwide, while shark attacks result in only 10 deaths per year. Another type of toxins which increases, at least in our area, due to climate changes are mycotoxins, so the toxins that certain molds produce. And they may become a huge problem because some mycotoxins are carcinogens. So the mycotoxin producing molds, they grow depending on temperature. And there's a higher contamination of food with mycotoxins if the climate becomes warmer. The increase in temperature and CO2 in the air and the change in precipitation promote the spread of mold, especially in corn and grain. And these form harmful mycotoxins that contaminate then our food and feed. Fungal species that are commonly found in geographical regions with higher temperatures are now also found in regions where they did not previously occur. For example, this graph shows a modeling scenario of the occurrence of aflatoxin contamination in maize at harvest, and it shows it under 3 different climate scenarios. On the left side, the present scenario, in the middle with an increase of 2 degrees Celsius, and on the right side with 5 degrees Celsius. And you can see that while aflatoxin contamination in Middle Europe is limited to the southern regions now, and under the current scenario, it comes up further to the north with 2 degrees increase and much further to the north with 5 degrees increase. Another problem associated with climate change is the use of pesticides. Food plants are more difficult to protect from pests when there is more heat and dryness or alternating drought and heavy rain. And it is expected that there will be an increased use of pesticides worldwide due to climate changes. With these very brief introductions into some of the emerging pollutants, I would like to close this lecture, and I have 2 more recommendations for reading or watching on the final slide. The first of which is a only 3-minute long film, but it's really worthwhile watching. And with this, I would like to thank you for listening.